Before we get started, I just wanted to take a moment to really honor both the AMOS staff and the communities that we work with, especially the health promoters, because Dr. Wu and I and Marissa, we're here talking to you today about AMOS's model and our approach using community-based participatory research. But really there's this gigantic, amazing team and partnership that consists of, about over 40 AMOS staff members and 23 rural communities, and then also a bunch of you as well who are our supporters. So just wanted to really honor that beautiful participatory partnership that we have going on. So thank you all. So just thinking about CBPR, which is Community-Based Participatory Research, which is one of the main kind of components to the AMOS strategy and how we work. CBPR is actually an approach. It's not a set of methodologies or a set of steps that we follow as we implement our work. So really the ideas and what we do using community-based participatory research approaches are all based on a set of principles, which I just wanted to share with you guys today. So there's a lot of different people out there who work in community-based participatory research. Some of our biggest mentors are Nina Wallerstein, who ended up mentoring Dr. Laura Parajon. So a lot of the work that we do is really based on a bunch of different research that she's doing and studies that she's doing as well. So the set of principles that we're going to go over, it really come from her work. So the first principle that we have here is people should need it. So people should need it. So when we talk about people, we're really talking about the community, and that the community is really the unit of identity that we're looking at, that we're working with. So this is in Nicaragua, it's people who occupy a same geographic location, but who also share a number of cultural norms. When the projects that we work on or the programs that we are working on are really needed by the community, they're locally relevant. So, we're not, working with academic and church partners to do different projects that aren't really based on the community's needs and wants and desires and vision for the future of their community. People should do it. So everything that we do is really based on the community's strengths and resources. So this looks like us really forming a partnership with different members of these communities through health committees and also health promoters, so that we can hear from them what are the strengths and resources available in their communities, so that when we do implement a project or a program, that it's really based on what is already available in the community, and it's not us bringing in a bunch of kind of outside materials that maybe the community couldn't resource for themselves. People should understand it. So this is something that's really important to AMOS, is we are always trying, as an organization, we have a lot of connections with people like you, with universities in Nicaragua and the United States, and just a lot of opportunities where we can gain new knowledge and new skills. What we always try to do is take any knowledge and skills that we learn as an organization and share that with health promoters and health committees in the rural communities. But also something that's really important about like capacity building is that we also see this as an opportunity for co-learning. So we really value what is known as indigenous knowledge. So really like learning from the communities and what they know, because we see them as our teachers just as much as we're their teachers. People should use it. So this is really thinking about a balance between research and taking action. So I work on the monitoring and evaluation team. So we get a lot of data coming in from the communities. So what we always try to do is make sure that data gets back to them in a form that they can use and then take action on it. So for instance, last year we completed censuses in all of the rural communities. So basically what we found during those censuses was like a bunch of communities may have not had access to the amount of latrines that they needed or water filters that they would have liked to have. So we presented that information back to them, and a lot of them formed plans based on that data so that they could take action. And then the last principle that we'll go over here is that people should own it. So we at AMOS see that any data that we collect, any project that we work on with the community is the community's data and it's the community's project. So we always want them to feel like, you know, they have an active role in designing any projects that we do, implementing any projects that we do, and then deciding the future of any projects that we do. And we believe that if we do all of these different principles, it basically leads to long-term sustainability, which is just basically the communities can organize themselves to do different projects or to improve situations that will end up improving health and well-being in their own communities. And so another kind of guiding idea that we have at AMOS is known as the Continuum of community work. So there's different types of either research or programs that all of us have seen implemented, you know, throughout our lives, and also even those of you who have participated with AMOS. So there are some projects that work, what we say is on communities. So this might be that the community isn't involved as much in these types of projects. So this is something like a vaccine trial, which is something that is really, really necessary, but maybe doesn't involve the community as much. In communities, community members are generally informed and share feedback to the people who are implementing the projects, whether that be an organization like AMOS or a research group, but maybe they're not really in charge of carrying out the projects. So for instance, in one time we worked with a researcher who was conducting an asthma prevalence study. She was working in our communities, but maybe didn't necessarily plan everything out with the community as a whole. When you're working for a community, this is generally maybe you're delivering resources that the community doesn't have but needs. And this happens a lot in kind of emergency situations. So we're seeing that a lot right now. So one example that we have of working for a community is AMOS is delivering food because not everyone has access, especially young children may lack access to food right now. At AMOS, we're always trying to strive to work with a community, which is having an equal partnership with communities and also with our supporters like donors and universities. So what this means is that the community is involved in every stage of implementation and design of projects. And so this is something that we're really always trying to strive for, while we recognize that all these different ways that we can work with the community are possible. And we do kind of work in all of these different aspects on and for and with. But right now, Dr. Wu is going to talk to you guys a little bit about how we're working with communities to respond to the COVID-19 pandemic.
So we are going to talk about the CBPR framework. How do we use this framework to have social justice outcomes in our programs? And for us to be able to do that, we need to evaluate very well the context in the communities and also how to identify the partnerships or the partners that are going to do all the actions in the community. And in that way, you can have a program or intervention or research that, as Jess said, it's not in or on, it's with the community, evaluating all of these parts of the framework. And in this picture, you can see that that's Isaac. He's from a community called El Socorro, and you can see Aura too there. She's from another community from Atagalpa. And what they are holding in their hands is this framework. They elaborate this framework, evaluating the context, because every community is different. And they evaluate what partners they have in the communities, what programs or interventions they need to have a social justice outcome, or in this case, an outcome that is sustainable and a long-term outcome, a context. So right now, let's talk about the health issue of importance in a community, for example, COVID-19. And the first thing that you need to evaluate is the social and structural factors. So in this case, in our communities, for example, we have problems like poverty, like unemployment, long distances from health centers, and we are lacking for water systems. So, for example, if there is a prevention measure like washing your hands frequently to avoid COVID-19, and you don't have running water in these communities, how are you going to prevent this disease, for example? So you need to evaluate the context and the policy and politics. It's very important also to know what the government is doing, and what are their um, uh, right now the interventions that they're doing to prevent COVID-19. For example, right now there is no national quarantine policy yet, and the borders are still open, and we are the only Central America country that we don't have a social distance policy in place. So it's very important to understand what is also the government, the health system doing in a health problem and in a health issue of importance in the community. And then you need to evaluate the capacity and the readiness of the community to partner. So you need to evaluate what is their like engage and empowerment to work for their community, and also what are their strengths and the willingness to serve, because that's very important. All of these health promoters and leaders that we work with, they do it because they want to serve the community. So you need to evaluate that willingness, and in that way you can develop a history of trust and collaboration. And in this context, it's very important, or for example, like the socio-political crisis in 2018, it is very important to develop this long-term commitment and relationship, because in that way, if we go to the community and share, hey, this is what's going on about COVID-19, and these are the preventative measures, it is more likely that they adopt these measures, and they can also not only adopt but also seek for the community to also follow up on these preventative measures, than if it's somebody else that hasn't developed this relationship with them. And it's very important right now to try to because there is a lot of misinformation right now about COVID-19. So it is very important to have that in a community, or in a context to implement any program. It is very important to know what is the history of trust and collaboration of that community. All of this context evaluation led us to identify the partners or the partnerships that we need, or that are in place in the community to implement or to work with in this pandemic. So in this case, we partner with our communities, and you can see there is Donald. He's one of our staff members, and he is training Agustin. He's from El Cedro. It's the furthest community that we work with, and he's trying to show him what are the prevent COVID-19, and in the right one you can see that, but there's a bottle hanging over there. So most of these communities don't have any running water, so we are explaining them on how they should do their hand washing in a correct way, because sometimes people think that it's very very easy, I wash my hands, but you need to do it in order and for how long. And the idea is that we share this information with them, and the idea is that they can replicate that in their communities and also with their families. So these partnerships that we build, it's very important. So who are the partners that I need to work with to make sure that all these preventative measures are being followed and adopted? So it's very important to develop an equitable partnership, because sometimes inequitable partnerships can have a totally different outcome, like a negative outcome. So what are the characteristics of an equitable partnership that allow us to have long-term outcomes in a community and social justice outcomes in a community. So you need to build the relationship, fostering trust. It's very important to listen because, as Jessica said, this is a co-learning process. So there is uh, knowledge that we can share with the community, but also we learn from the community. So it's very important to listen and to share a long-term vision with them and to promote this mutual learning. And this will facilitate the reflection and dialogue that you need to develop empowerment in a community. So it's very important to develop all of these characteristics, but also you need to serve with humility and love, because without that you can't do the equitable partnership. So this partnership, we try to frame it in this three-way partnership framework that you're looking over there, where the community is the most important thing. The community promotes bottom-up development. So there is a census when you need to know your community, and we say that everybody counts and everybody's counted. So this is how you can identify who is most vulnerable in your community, for example. And also another important thing is the government, because the government has all of the policy that comes top down, and it gives the health structure in the communities, and it also helps to set up the basis of the health system in the community too. And there is also outside facilitators as AMOS. So what is our role here? So what do we do is to try to partner with all of kinds of people that is interested to help the communities to have success outcomes, like churches, universities, and people like you, for example, that have this long term relationship with us as an organization. So in that way, we can help these communities to facilitate this process.
So I'll just be here to talk with you guys a little bit about the program interventions that we've been doing, especially based centered on our COVID-19 response. So as Dr. Wu said, you really need to understand the context and then your partnership values and principles that you bring when you're implementing a program or research. So the first step is to take action based on local data. So how this looks at AMOS is all of our communities have local monitoring and evaluation systems set up. Based on the COVID-19 response, we've asked the promoters, who are the ones who collect and send data, to send us weekly updates about the number of cases, upper respiratory cases that they're seeing in their communities. And with that, we're going to be able to change our strategy, because as the number of cases of upper respiratory infections increase, that probably means that we need to be changing our strategy and how we're working with the communities. We also called all of the health promoters and chatted with members of health committees to understand what they knew about COVID-19, and also to ask them what were some of the biggest barriers that they were facing in their communities. So a lot of them shared that there was a lot of misinformation going on, that they hadn't had a lot of contact with their local Ministry of Health officials who visit their communities on a weekly or monthly basis. So we took that information and responded, sharing information from the CDC and the WHO, and sharing with promoters where they can find valid information as they're working in their communities. We also worked with them to learn how to identify suspected COVID cases so that they could send those cases on to the Ministry of Health system. So I kind of touched on this, but we talked with the health promoters, and we're also working with community volunteers that we call water promoters, who are really working with our water sanitation and hygiene projects. So we ended up working with them, learning from them, and also training them in the learning to identify suspected COVID cases, and also how they could establish those mobile hand washing stations, which you saw in a previous photo. community participation. So we're really hoping that by spreading information to diverse community members, they're going to be able to get this information to members of their community who are especially marginalized. So a part of the context that we maybe didn't mention was a lot of people do not have access to telephones in the communities that we work in, or the signal is pretty spotty. So kind of mass communication campaigns where we can be sending messages and talking with people really isn't a possibility, or people just don't have phones. So we're really relying on these local community volunteers to be able to spread information, especially accurate information. So basically, when we think about the context and how we're partnering together and are coming up with our interventions and research with the community, we're always striving that this be something that is culturally centered. So that's kind of something we shared about in the principles, but just making sure that all of our responses are based on the resources and strengths of the community, and it's something that's needed by the community. So we're not, in this time of COVID-19, we're not, talking about a different disease that maybe doesn't impact much of the population. So we're really focusing on what's important to the community. We're also thinking about what roles different partners are playing in our strategy. So what role does AMOS play as an organization? What role do health promoters play, other community members play, and people like you who are supporters, our donors, or university partners? How are we all tackling this issue from different angles? And then we're always wanting to assure that anything that we do is a human centered design, that it's really appropriate for the communities that we're working in. So, as we're implementing different programs or sharing information, there are a lot of different challenges that can present themselves, especially in a time of emergency. So kind of as we were mentioning earlier, the lack of access to cell phones and the fact that our whole team can't be visiting communities as often as we would like to be, and meeting with diverse members of the communities means that right now we're largely communicating with health promoters, members of the health committees, and these water promoters, or a few other community volunteers. So we are not necessarily communicating with the most marginalized members of these communities, just because it's really difficult right now. So that is a challenge that we're facing, and something that we're really hoping that we can look for creative solutions to address. Because, as Dr. Rawu said, dialogue is really important, and including diverse voices and these responses is really important. So we don't just want to be talking to a couple members of the community. We want to be getting as many diverse viewpoints as we can. We're also thinking about ways that we can be using technology, especially cell phones, as if there is a time when our staff can no longer go out to the communities. For instance, if the COVID-19 pandemic gets a lot worse in Nicaragua and our staff need to quarantine at home, how can we be communicating and increasing communication with the communities that we work alongside? So I think I actually covered most of these things, but just to cover a few other ones, we're also working with health promoters right now on stigma. Especially, there's a lot of different groups that are coming back, that are migrating back from Costa Rica and El Salvador and Panama, where they work. So these people that were returning from those regions were facing a lot of stigma coming home, and our promoters also didn't really know what to do or how to care for them. So right now we're working on different plans on how to work with people who are coming back who could potentially be vectors for this disease. We're also thinking about how we're going to address mental health with communities. So we are trained in a methodology called restorative justice circles. So we're thinking about how can we implement that with community members. We're also thinking about psychological first aid, just because we know that it's a really difficult time. Right now, our team is out in the field actually sharing some really basic messages for mental health and where people can access reliable information, because that is a huge source of uncertainty and stress for a lot of people. And I'm sure all of us have experienced that looking at social media. There's just a lot of different messages out there that can be confusing. This slide just really kind of shows you a bunch of different pictures of the interventions that we've been working on and implementing with community members. So the top left picture is one of our staff members working with a health promoter, just sharing the most up-to-date information and also cleaning supplies. That was a really important feedback that we got from health promoters. They were really worried about how they were going to be sanitizing and keeping their community clinics clean. If you move over to the right, we see one of those mobile hand washing stations that we are encouraging health promoters to put up in all of their community clinics and public spaces like schools and churches, and also individuals can put them up in their homes because, as you can see, this is based on resources that everyone can find locally. And then the bottom picture, you see one of our staff members working with different community members to share up-to-date information about COVID-19 and reliable sources of where they could get that information. So the last part or domain of the CBPR guiding framework is social justice outcomes. So what do social justice outcomes look like in the height of a COVID-19 pandemic? So what we're really hoping is that our community-based primary healthcare systems can really help address the COVID-19 outbreak if it happens in Nicaragua and when it happens in Nicaragua. So right now we don't have any cases of COVID-19, but we're hoping that promoters can work on prevention practices. And then when the time comes when we need to mount a response for COVID-19, that they're prepared and are integrated into the community the national health system of MINSA. We're really focused on keeping our health promoters safe and community members of the health committees safe. So providing them with some protective equipment, right now we have cloth masks. We weren't able to source surgical masks at the moment, but they all have gloves and they have resources to clean their community clinics. Something that's always really important is sustainable and long-term partnerships with people like yourselves, with AMOS as an organization, and with the community. So how are we all working together and empowering each other in our work? Trained and well-informed community members like health promoters and health committees are really important, especially in this time. So making sure that these health promoters and health committee members have the knowledge, skills, and resources that they need to be able to respond to the COVID-19 pandemic. And then finally, we're hoping for a sense of strengthened community empowerment. So right now, why that's really difficult, kind of for a number of reasons that we talked about in the context. We're really hoping to look for creative ways where we can be communicating with more community members and making sure that those on the margins are feeling safe and empowered in their day-to-day lives to improve health and well-being in their communities.